Hello everyone, I'm Gabriel C. Welcome in Studio 1. Today I'm going to share with you the process of making or writing a nursing care plan by student nurses. I will share to you vital informations and tips on how to create a good nursing care plan. Let's start the ball rolling. What is a nursing care plan? A nursing care plan documents the process of identifying a patient's needs and facilitating holistic care, typically according to a five-step framework. A care plan ensures collaboration among nurses, patients, and other healthcare providers. What are the purposes of writing a nursing care plan? The purpose of a nursing care plan is to document the patient's needs and wants, as well as the nursing interventions planned to meet these needs. As part of the patient's health record, the nursing care plan is used to establish continuity of patient's care. What are the components of a good nursing care plan? Care plans are structured as a five-step nursing process. These include assessment, diagnosis, planning, implementation of interventions, and evaluation. Step 1. Assessment. The first step of writing a nursing care plan requires skills in data gathering. Nursing universities and healthcare organizations use different formats for the assessment stage. In general, the data you will collect here is both subjective cues and objective cues. The source of the subjective data could be the verbal statement from the patient or their caretakers, family members, or friends. On the other hand, the source of objective data could be the findings from performing a thorough physical head-to-toe assessment using inspection, palpation, percussion, and auscultation. Also, you can include an important abnormal vital signs, intake and output, diagnostic laboratory results, medical and surgical history. It is very important for a student nurse to develop the skills in interviewing clients and performing physical assessment. Let us analyze this case scenario. John Doe, a 30-year-old man, is currently in the emergency department due to gunshot wound to his right chest. He said, "I can't breathe properly." Vital signs: respiratory rate 30 breaths per minute, SpO2 85%, heart rate 125 beats per minute, blood pressure 145/90 mm mercury. Capillary refill time is less than 3 seconds. Pain score 8/10. Blood glucose 4.5 millimole per liter. And temperature 36.5 degrees Celsius. John Doe has cyanotic lips with absent breath sounds to his right lung. Chest X-ray revealed right hemopneumothorax. ABG results: pH 7.32, PaCO2 50 mm mercury, PaO2 78 mm mercury, and bicarbonate 24 milliequivalent per liter. Identify the subjective cues and objective cues. In this nursing care plan, our subjective cue is patient's statement of not able to breathe. The client's objective cues are the following: respiratory rate of 30 breaths per minute, oxygen saturation of 85%, cyanotic lips, absent breath sounds of the right lung, chest X-ray of positive right hemopneumothorax, and an arterial blood gas result of respiratory acidosis. In this scenario, the patient's right lung was greatly affected due to gunshot wound. This requires highest priority of care. Therefore, the cues in this nursing care plan are actual signs and symptoms affecting the respiratory system. I hope you learned something today on the first step of writing a nursing care plan, the assessment. The second step is nursing diagnosis, which will be discussed in the next video. And that's the way it is. I'm Gabriel C. Thank you so much for watching. Until next time, stay safe everyone.